We have a lot of patients come in, they're truly embarrassed about their smile. They're afraid to show us their smile, but ultimately the first step, if you're fearful, is just to come in, have a consultation, and just meet us. Margaret's a great example of someone who's truly embarrassed when she came to our office. Big day today.
Yeah.
Her mouth is a very difficult case, and no one really knew where to start. So she had implants done, and they didn't do it the right way.
I did a lot of things, and I tried to do them slowly at a time, and I wound up probably spending a lot of money, but it wound up not working out for me. This down here is a partial, and as you can hear when I talk, sometimes it whistles a little bit. This is a bridge, but then the bridge started to break. I went to other dentists. They wanted to remove all my teeth, and they said it would be weeks before I had anything. And being a professional, I can't do that. It would be devastating.
When you see someone that is so not confident and not happy with themselves and they don't even want to smile anymore, they're depressed, they don't go out, you don't think about how much your smile really affects your life, and it does.
I've always had a great smile. Everyone always said, "Gee, you have a great smile." As the years went on, with smoking, with genetics, my parents did not have the best teeth, and probably with not the greatest dental care, I lost my smile, and my teeth got yellow, and my gums were a problem. I was offered Band-Aids, what I thought were Band-Aids by some dentists, but I didn't want a Band-Aid. I wanted to have a full, beautiful, comfortable smile again.
When Norma came in, she was very skeptical. She was suffering from severe periodontal disease. Her teeth were literally falling out of her mouth. And once she saw that her teeth were getting looser and looser and looser, and that she was hiding her smile more and more, and then she spoke to some of our existing patients who've had the work done for years in their mouth, she really knew that she was in the right place to get it done.
I must have interviewed 6 or 7 dentists, and I didn't feel comfortable. And when I finally found Dr. Najat, I felt very comfortable with him.
When I see the patients come in, they're scared and they're apprehensive.
Excited, so you're doing nervous. Excited.
Yeah,
Okay.
a little both.
And then by the end, they're smiling and they're so happy, and it's a great thing for all of us to witness. We see a lot of transformations here. It's wonderful.
The first step is to educate the patient on what we do and how it's different than what's available out there. So give them options. We don't like to put anyone in one box and do anything like an assembly line. We like to do things in a customized way, so they understand that what they're getting is developed for their smile and for their needs. So the first step of the process is we take some simple impressions of their mouth. From there, what we'll do is have this patient wear this special device, something that we developed, we achieved a patent on, during a 3-dimensional image of their jaw. So it's a 3-dimensional X-ray. Then what we're able to do from there is to design everything on a computer so they know what their teeth are going to look like, and we can make any changes if we need to. So when the teeth are fabricated, we're ready to go. With this Smile in a Day approach, using 3D planning and designing, we're able to place implants that are specially designed in specific areas of the mouth using a CAD/CAM surgical template, so they can leave with teeth as quickly as possible in the least invasive way. And after we're done, you're going to leave with teeth, not a denture. You're going to leave with the teeth that you have a nice smile with.
It's amazing how quickly we're able to do these procedures from start to finish. Traditionally, in the past, you had to wait months and months just to get implants placed, then you had to wait months after that just to get the crowns put in, and months after that for healing time for the permanent crowns. What's really nice about what we do here is that we try to consolidate all of this into one visit.
I'm really looking forward to Friday and having this operation. Now, who can say they're looking forward to having an operation? But I can tell you I'm looking forward to it.
I did have a nice smile, so to get it back is going to be amazing. It's going to give me the confidence to smile and be happy. It's a big weight lifted off my shoulders, and I'm very happy now. I didn't like to speak a lot or talk a lot because I didn't want to draw attention to my dental problems. And now I don't have those issues anymore. For anybody who has issues with their teeth, I know what they're going through, and I know the place you could be in, a very bad place. I thought it was hopeless. I thought that was it. I would never be able to have teeth like this without robbing a bank.
So Margaret's outcome was fantastic. She had started off with no smile whatsoever, and then her lip didn't move properly. So what made it really difficult was it was like having a picture frame that wasn't squared properly. So we had to do a surgical procedure to correct her lip so she wouldn't have such a gummy smile. And that really made such a big difference. It allowed us to have more of a nicer frame to get her teeth set into it.
When my mom first got home, her teeth were just like unbelievable. I'm still all right now.
Margaret is a different person now. She genuinely is. You know, when she first started working with us, she was very down on herself. It really inhibited her ability to function. And then once everything was completed, she has this glow about her.
She's been a lot happier. She still yells at us, but
In a happy way.
yes.
And it's just really nice to see we made such a change in her life.
I was beyond belief happy with the new look of the teeth. He fixed everything. I mean, it's unbelievable. I love smiling, and for years, because I had bad teeth and bad gums, I didn't smile very much. So now I'm smiling all the time.
Norma was very skeptical through the whole process because she had some friends of hers and even her own dentist who really said that this is impossible to be done. They weren't aware of the newer technologies. We're able to have her leave with just amazing results and making her look 20 years younger. Now, the way this was created was from 3D printing. This
Dr. Najat, wonderful doctor. I mean, as you can imagine, I felt hopeless. I think he understood how personal this is. So he wants to make sure that you're happy, and he took his time with me.
You're going to be totally numb during the whole process. If you feel anything, raise your hand.
I sat down in the chair at 1:30. Dr. Najat gave me one Novocaine shot, and from that point, I felt no pain at all. I was overwhelmed by what I had expected and what occurred. I had absolutely no pain. I'm not exaggerating. It's really one of the nicest things I've done for myself in my life. My only regret is that I didn't find Dr. Najat sooner.
For anybody who has issues with their teeth, it's not the end. There is hope out there.